September is Prostate Cancer Awareness Month, and for millions of men across the country, this is a crucial reminder about the importance of early detection. Joining us today is Dr. Sandeep Bhave, a radiation oncologist with Franciscan Health, to talk about why screening can save lives. Thank you so much for being here.
Thanks for having me on.
So let's start with the basics. For those who may not know, what is prostate cancer and how common is it among men?
Prostate cancer is the most common cancer that affects men and the second most common cause of cancer deaths in men. It is a cancer of the gland in the male reproductive system and typically presents with very little symptoms. It's typically diagnosed on a blood test, but when it is, other symptoms can include changes in one's urination as well as sexual side effects.
So how does screening work? When should we get screened for this?
Screening has become a controversial topic and has been the source of Twitter tweets and other things. But in particular, men starting at 50 should have a strong conversation with their primary care physician about the role of screening for them. If they choose to initiate screening, it should happen every 2 years or so with PSAs. In men with higher risk, such as a family history and in certain ethnicities, such as African American men, screening should start earlier in their 40s.
And a PSA, remind us, is what?
It's a blood test looking for a protein called prostate-specific antigen, which is relatively sensitive for looking for prostate cancer. When it's elevated or above 4, that increases the likelihood that there could potentially be cancer, but there are other causes such as just growth of the prostate, among other things, that can cause an abnormal elevation. So it needs further workup. Sometimes
there is some confusion or fear and anxiety about getting screened, and perhaps if that number is high, moving ahead and doing a biopsy procedure. What do you say to men who are hesitant or unsure?
So it's important to get screened because if we can find the kind of prostate cancer, that'll help us guide what we would recommend. And in the vast majority of men, prostate cancer, if found, is low risk. And in the majority of those men with low risk prostate cancer, they can be followed with active surveillance, where about half of patients actually don't need treatment at all. They just are followed with PSA tests and biopsies as needed. And so for the vast majority of men, treatment may be able to be avoided or delayed for a long time. And if treatment's needed, it generally is quite tolerable.
Well, let's talk about treatment. What are the options when you do reach the point where you need to be treated so it doesn't spread?
There are a vast array of options we have to treat prostate cancer. The two most common being surgery, a prostatectomy, where the prostate is removed and sometimes the lymph nodes are sampled as well as radiation therapy, where radiation can be emitted externally from a machine or internally with seeds. Other options include using high-intensity focused ultrasound, or HIFU, and cryotherapy, where cold therapy can be used to treat prostate cells. But the two most common are surgery and radiation therapy.
And so how important is it that men get screened at an early age?
It's important because if we can catch it early and know what their risk profile is, we can decide how aggressive we need to be with treatment. In a patient with low-risk prostate cancer, they can sometimes be surveyed for many, many years without any treatment initiation. But in the off chance we catch somebody who has a high risk or an intermediate risk prostate cancer, we may need to initiate treatment much earlier. And sometimes that can be the difference of many years of life.
And you mentioned symptoms, sometimes there are none, but what are some of the symptoms that we should be watching for?
In general, people can notice changes in their urination, so they may not be able to complete their stream. They might have starting and stopping in their urination. They might also notice some just general discomfort in that region. And another factor that also men might notice is impotence. And that can be a cause of a lot of distress. And it's important for us to kind of rule out many causes of impotence can happen in men. And one of those causes can be prostate cancer.
All right. Dr. Bhave, thank you so much for being here. Really appreciate it.
Thanks so much for having me on.